Thanks very much, Sarah. There's a little background noise, so if people are able to, you may want to try and mute your sound until we get into the discussion. Let me begin by thanking all of you so much for joining me on the call. And most of all, thank you for what you have all been doing during the last several months of this pandemic. I know that you've been on the front lines. It's been very challenging, and I know I speak for everybody in New Hampshire in saying how much we appreciate your willingness to put yourselves at risk and continue to do your job in such a great way that protects all of the citizens of New Hampshire. So thank you all so much. I've had the opportunity to speak with a number of you over the last several months, but I wanted to bring folks together because, as you're probably aware, we are looking at another legislative package of help for people across the country. It came out of the House last week, and I'm interested in what you're experiencing and what you would like to see in the way of help. I think it's fair to say that in the CARES package, we probably didn't have as much help for first responders as we all would have liked. And so looking at this second package and thinking about what we can do to support your efforts is really important. Let me also say, and some of you are probably aware of this, that one of the biggest disagreements in the CARES relief package that we passed back in March was over how much help would go to the state and local level to support first responders, firefighters, police, EMTs, to support municipal workers, to support teachers. And I expect that will be another disagreement when the House package gets to the Senate. As you may know, there is over $900 billion that, about $1 trillion to go to state and local governments to try and help with folks. I know that across the country, and I had a call with mayors a week or so ago, and they were talking about their concerns with budget season, not being sure what revenues were coming in, concern about maybe having to lay off people at the municipal level and what that would mean. And so I want to know as much as I can so I can make the best case possible for what we need in New Hampshire to support all of you. Because as we know, this pandemic is not going away as fast as we had hoped it might. And we are probably going to continue to deal with these issues at least through the summer. And since we don't know what the future looks like, I want to make sure that we have the support we need. So again, thank you all so much. And I'm going to turn it over to Sarah so she can run through the list and I can hear from each of you what your concerns are, what you're experiencing, and what you would like to see.
Great. So I'm going to start with Bill McQuillan.
Hi.
Hi, Bill.
Thanks for taking the time to meet with us here this morning, Senator. I appreciate your efforts. I know one of the things that we're certainly most concerned about is the fact that a lot of the initial aid that has come into the state hasn't been earmarked for the municipalities to be able to replace lost revenue as we hear this pandemic going on here into its fifth month. And I think as this starts to play out, I know that our concern is looking out a year from now to the next fiscal year and beyond, and what that lost revenue is going to mean for service delivery. What we're looking at and what we're fearful of is that the way that the local municipalities are going to make up for this lost revenue is by service cuts and cutting the services that ultimately the public are relying on to be able to fight this pandemic.
Thank you. I'm taking notes. So.
Oh, I know. I didn't want to get too far ahead of you.
Okay. And have you talked to, maybe some of the fire chiefs who are on can also speak to this, but have you talked to Portsmouth officials about what they're seeing and what they're expecting and what they need as they're thinking about going out into the end of the year and the beginning of next year?
You know what? I think Chief Germain's probably better posed for that question. He's in the middle of the budget process as we speak.
Good. Oh, we will get to him shortly then. Thanks.
Good. Anything else you want to add, Bill?
Well, I think the other thing that is going to be critical for us is to be able to get that waiver on the grants for us to be able to use existing grant money to keep people, not necessarily for new folks and new hires. I think that's going to be terribly important as we go on in the outer years to be able to retain personnel and keep them on shift and keep boots on the ground.
Yeah, thank you. One of the things that I was disappointed in the CARES relief package is I thought that the money that we had provided, particularly the $1.25 billion to go to the state of New Hampshire, that our intent was to allow flexibility to use that money to help backfill budgets and to use to make up for dollars that had to be spent to address the coronavirus and fill that in. And unfortunately, the Secretary of the Treasury has issued guidance, as you all know, that has refused to allow that to be used for backfilling those budgets. So I'm hopeful that what we do in this next package is going to be much more flexible and provide the ability of states and local governments to use those dollars the way that you need to. That's the way the bill is coming out of the House. So hopefully we can preserve that in the Senate.
Great. Thank you.
Chief, you're going to talk about.
Yeah, I was going to say, Chief Germain, do you want to go next?
Sure. Good morning, Senator. Good to see you. Yeah, like Billy said, we're in the middle of budget season now, and as unconscionable as it may sound to all of us, in the panel here, the discussions are being had at this moment about reducing services or perhaps laying off public safety personnel, amid a public health crisis, and to be able to really anything that comes down the road now, if it doesn't end up in the hands of the municipalities to be able to cover those costs and try to recoup some of that lost revenue, I'm afraid that, and we're lucky here in Portsmouth, we've had a pretty strong economy over the years, but, there's other parts of the state that certainly haven't enjoyed that robust economy. And I can't imagine what the decision makers and the fire and police chiefs and so on in those communities are having to deal with, and the reality that they're facing, that they're going to lose personnel and services. And it's just the reality. And we're in the middle of our budget season, and we're fighting every day to keep what we have, because we know that this isn't going to go away. It hasn't been cured. It hasn't been, there's no vaccine. It's still around us. And even though people are anxious to get reopened and get out in the public, it's not gone away. And we're fully anticipating, and it would be irresponsible of us to not anticipate and plan for rebound infections and outbreaks that, and as we've all heard, we're in the front line of this thing, and we need to be there. And I'm afraid that in 6, 12, 18, 24 months, there's going to be less of us to do that, and we're not going to have enough to do it safely. So that's where we're at. It's pretty simple.
Have you been given any guidance by the city on what you should be thinking about and preparing your budget? I know because of my call with the mayors and some of the town administrators, they told me they were concerned about revenues coming in at the town and city level and what that was going to mean for budgets, and not knowing what to count on from the federal dollars. Is there guidance? I guess this is something I would ask to all of you. Are you being told to think about flatlining your budget requests or reducing it by any amount, or has there been any of that kind of guidance?
Yes, obviously they're concerned about the revenue, the tax revenue coming in, not so much this one coming up, but the one in December. But we were just directed 2 nights ago to present what the impacts of a zero increase budget would be. We all know that we have our fixed cost increases and we need those. And, we're like any other fire department in the state. We're already down to what we can work with and maintain staffing. So a 0%, increase for us is, we're looking at loss of services. We're looking at, closing an ambulance. We're looking at closing a station. There's things. It's going to be impactful to the protection of the public. But that's what we've been asked to do for the next budget hearing, is to come in and explain to the council what the 0% increase over last year. And I'm hopeful that that's as far as deep as they're going to go, and not try to go back to, FY 17 and 18 actuals, which is it's been tossed around as well.
Wow. And at what point do you have to start laying people off?
Right. I mean, we're fortunate. We may be able to hold off on that for a little bit, but it's gonna result in a reduction in services. We'll have to not staff an ambulance or not staff a station or something. But I mean, we'll do everything we can to hold the people we have, but it will reduce either services or personnel one way or the other.
Yeah. Thanks very much. Again, having that information is helpful as we're trying to advocate for what we need in New Hampshire. So thank you.
Sure. You're welcome.
Good, thanks, Chief. Next up, can we hear from Chief Watkins from Borland? I'll unmute you. You're good, you're unmuted.
Can you hear me?
Yes.
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 I know I keep saying I'd like a mute function in the Senate so we can mute some people when they talk too long, but no such luck.
Well, I think it's well documented that unlike Portsmouth, we do not have a good economy up here in the city and in the valley. I think we're going to be good for this budget coming up, but there's already talk of layoffs for next year, again, with the next round of the taxes. We're very close to purchasing the private ambulance and bringing in the EMS services into the firehouse. And unfortunately, because of the uncertainty of money, that ended up getting nixed last Monday night, which unfortunately sets us up for layoffs next year.
Wow. One of the things that I think is helpful in the House bill that we need to hopefully get done when it comes to the Senate is the local share for the SAFER grants and the Aid Firefighters grants is waived. So that 25%, and also on the Stafford program, they waive the 25% match. So hopefully that is one way to help communities as well as the funding.
Yeah, so like I said, I think we're good for now, but everybody from the mayor down is very concerned about next year.
Yes, the mayor made that clear when he had the call, that he's very worried.
Yeah. Yep. Anything else I can answer for up here in the North Country?
Well, are you seeing, as you're thinking about reopening, are you seeing any reaction yet? Things going well? I know in the North Country hasn't been quite as hard hit as some of southern New Hampshire in terms of positive cases of the coronavirus and deaths. So is it too early to see any kind of reaction to what's happening with reopening?
No, not yet. I think this weekend will be the big one because the ATV parks are going to open up. And I know that, we're going to open up the city streets to the ATVs, but to Berlin residents only. But we all have a feeling that we're going to get inundated with out-of-towners. I think the next month for us will be very interesting. Obviously, if we have people from Massachusetts out on the ATV trails, that's fine. But they're going to have to come in and get fuel and go to the grocery stores. And I think the next month will be our test. We've been fairly lucky up here.
Yes, well, let's hope that continues.
Yes.
Thank you very much.
Thank you.
Good, thanks, Chief. Next up, we have Chief McMillan from Hanover.
Great, how are you? Am I unmuted?
Yep,
You
you're
are.
good.
Okay.
We can hear you.
So we're in pretty good shape right now. We were at the epicenter and actually opened our
Right.
VOC about March 1st. You're very much aware of that. With a full load of college kids, and they run a 4-term. So we were really thinking that I was going to have a tremendous number of vectors coming back to Hanover, and from all walks of life, and practically every country in the world. And the college really stepped up and saved the day for us. I think we were only reporting some numbers, 15, 20 for a while in Hanover. But actually, because we didn't have testing, my health officer was working with a college, and we had quarantined a lot of students. And we think our actual numbers were considerably higher than that, maybe 10 or 15 times that number, in the 200 range or plus. But we were able to maintain it. And so we're right now kind of coasting, for lack of a better term, waiting to see how this is going to play out as we start to open up. On a budget perspective, I'm in a unique situation. Hanover, all the other departments are in a general fund, except the fire department. So I'm in a unique situation where I have my own separate budget. So we started reducing some of our costs. And I usually, even in a given year, will tell people spend 50% of your budget line in the first 6 months, another 25%, and we always hold 25% for that last quarter and just take a look. So we've basically just stopped spending to see how this is going to go. Our run volume's down, so that's impacting a little bit, but we're stable. I think our workforce is stable, and I'm sure you've probably had a conversation with Julia about looking at revenue, in the area. So I'm sure she's updated you in regards to that. I just have 3 really quick things that, if you don't mind, I'll throw out there from my perspective of what happened initially. So we started looking at this with the expectation that we were going to have some issues back in late January and February, and ordered some PPE. What was very, very interesting is PPE that we would have normally got from our suppliers, we didn't get it, and it got rerouted. And I think the feds at that point in time jumped in. So we're just now starting to get some PPE that we ordered 3 or 4 months ago. But the whole PPE chain, once we move forward and we start getting sufficient amount of PPE. Obviously, I know you want to restock the federal strategic reserves, also on the state level. But I think that we got to get into this culture of PPE now is commonplace in the households. Just like you go to you grab a Band-Aid or whatever. I think in the United States, we need to start thinking about everybody needs to have a supply of masks and gloves and some of those things. And if we can just over time in the future, because I don't think it's going to go away. I think I'm looking at this thing down the road another couple of years or better, right? And how we're going to react to that. So the PPE supply chain, and then not having PPE that sits on a shelf for 12 years and then is outdated. And is there some way that we can rotate stocks to the hospitals and keep a supply of PPE that never runs out as far as its use dates? We've got some PPE that we threw out last year prior to this, where the elastic on the mask was just falling apart. So that's the first item. The second item is HIPAA. So when we initially had our first cases that came from Italy and affected the hospital, we were told, due to HIPAA regulations, that the information couldn't be shared with us, and it leaked out, and we had a rumor mill. And so what really needs to happen is both HIPAA on the federal level and the state level, those need to be relaxed so that in New Hampshire, Health and Human Services has the ability in the MESAs, because we're underneath that, to share that information with us so we can basically have situational awareness. And we went for a long, long time without sharing some information. And then all of a sudden, and then this is in no way a slam, the commissioner, I catch a WMUR situation where she clearly identifies 3 long-term health facilities, one in Concord, one in Derry, and one in Salem, and then said X number of patients were exposed and X number of staff were, right? So that information all of a sudden went out, and we're going, hey, how about us? Why aren't you sharing that information with us? And the excuse always was, we have federal HIPAA and we have state HIPAA. And I really think that it should be a priority that we can somehow relax those guidelines and share information and not silo it. It would really help us from a planning perspective. And then what was my third item? On the grants. So I recently applied for a AFG supplement for the PPE. And just to compare that with what the stimulus grant that came out from New Hampshire, we received or will receive about $115,000 between both the police and fire. That took about 30 minutes to put that grant together. I put a $10,000 PPE grant together and had to work a day and a half on it. You know, I mean, it just needs to be simplified. And I understand that with the AFG grants, that sometimes they have to look at those because there's not enough money. And so they've got to prioritize. But if they could streamline that a little bit and make it easier in the future for us, that would really be helpful. And I know there's some more grant money out there. So those really are my three things. The only other thing that I would mention, I don't want to take a lot of time, is for communities that are trying to spin up the alternative care sites. I think we've got the funding for those straightened out, but that's crucial. I mean, we could spend $100,000, in a heartbeat, and to run these things for any kind of time frame. You could easily spend $1 million, depending on whether you're running 100, 150, 200 people, just trying to feed people alone for that length of time and cost.
So when you say alternative sites, are you talking about for homeless or for people who?
For the hospitals, an alternative care sites. I'm sorry, I wasn't clear.
I got it.
So we spun one up at the college, and it took a little while. And I know we've got some up at the state. I know there's a conference call tomorrow to speak with particular about that issue, and I don't know whether some are going to close. We're kind of up in the air on that with a question mark, depending on what's going on. So again, I'll thank you for your time. I don't want to keep going here, but those were some key points, and I hope those were helpful.
Yeah, they're very helpful. Thank you. I think that the PPE, one of my biggest frustrations, and I know it's shared by people on the front lines and it's shared by my colleagues in Congress, has been the two areas where we really need to have more help is with PPE and with testing. And it's been a problem from the very beginning. And we've got to figure out a way to better provide both of those. Now, one of the things that I know is happening in New Hampshire that's positive is there are several companies that are working on actually making the PPE in New Hampshire. And that would help us a lot. We've got to do something about our supply chain. Now, as all of you know, so much of our supply chain for PPE and for medications has gone overseas, and we've got to get it back so that we're better prepared in the future. On HIPAA, I think it's going to be, as we think about opening up and listening to some of the reports from restaurants, for example, restaurants that are trying to open up, one of the things they're doing is asking a lot of those personal questions when people come into the restaurant. So we've got to figure that out, because if we're going to contact tracing with people, we've got to be able to share that information. So we have to figure out how to do it in a way that preserves privacy, but also allows us to get information so we can make sure that we don't have the kind of hot spots that are going to make opening up even more challenging.
One of my favorite words is the word balance, and I use it sometimes too much, but we have to balance.
For sure.
And that's kind of that's about the simplest way to phrase it,
But I couldn't agree more on the streamlining the AFG application. So many of the applications at the federal level are too complicated, too bureaucratic, and we got to figure out how to streamline them.
Okay, great. Thank you, Senator. I really appreciate it. Thank you.
Thank you.
Good. Next up, we have Chief Drake from New Hampton Fire.
I want to thank everybody for all that they're doing, and it's been very helpful to sit in on this. I'm in a small community here in New Hampton. We rely heavily on part-time employees. I'm part-time myself. This event, this pandemic, we started looking at it back in January. We had a small contingency of out-of-country people coming back after Christmas vacation. And my concern was that, it might come into the school here and spread. So we started in January. looking at that. A lot of the information that the chiefs have put out already is pretty much the same things we're looking at. I serve on the board of selectmen as well as the fire chief, so we've started talks about the budget impact and what we're going to have to look at for lost revenues, especially for next year's budget season. Fortunately, that'll start in September for me, and I'm going to retire here at the end of September, so I'll have to pass that on to a new fire chief. But again, the same issues affect pretty much all of us. We have to look at what we can provide for a service based on the amount of money that we're given, and we're hoping we don't have to reduce that service. But that's something that's out there in the future budget. So again, the AFG grant, I've watched that over the last, 12 years. It was designed to be a very basic grant application, and it's kind of, turned into a long-term, gathering data, statistics. It seemed like every year I watched it get more difficult and more difficult. So in the same with some of the grants the federal government gives out, we rely on a lot of part-time or volunteer people to do the legwork for the grants. And they seem to get harder and harder every year. More things are required. So that's a big issue. Again, the HIPAA thing, that was a big issue when we were doing the conference calls with the state. And I understand the state has to make sure that we meet all the legal requirements and stuff. Sure. It's important that we get notified when we have potential hotspots or people with the COVID. We signed the agreement to get the information. And we're fortunate that we're in a small community, so we're well spread out. We're not the population density isn't as high, so we kind of sheltered in place, and we were lucky to have just a few people. One of our big concerns during this whole process was the out-of-staters coming in from the hotspots, Massachusetts, New York, Rhode Island. We had a big influx of people coming in and buying one of the grocery stores in the area. The manager went out one day and counted probably 2/3 of the parking lot, which was full, had out-of-state tags on it. So,
and are these people who have second homes in the New Hampton area who are coming up and staying during the worst of the last couple of months?
That was talked about. That was the concern was, well, they have a second home up here. They should have a right to come up here and stay. And I say, that's not a stay-at-home order. That's not following a stay-at-home order. That they should stay at home where they reside and not come up here. I know there was a lot of issues with the North Country in Lincoln and up in North Conway and so forth. But we saw it here. We have the main thoroughfare, 93 North, coming through, and you could go up there for accidents, and you saw a lot of out-of-state plates. So that was a big issue for us.
And was there any evidence that they brought with them the coronavirus? Did you have any cases that occurred, do you think, because of that?
We did not. But, they didn't really stay in New Hampton because New Hampton, has a smaller summer setting where people would stay. But they traveled through, they stop at the gas stations, they stop at the grocery stores, and that potential always exists. My big thing was, just to reaffirm that stay at home means stay at home. Don't take a vacation in New Hampshire, So that was really a big thing with us.
And can I ask, did you have any trouble with PPE? Has that been an issue for you all?
Initially we did. We did have a problem with PPE. We ordered some PPE in January. We were able to get a small amount of it, but shortly thereafter, the PPE supply dried up. Fortunately, we're currently working with the state. We're dispensing PPE
Right.
here at the fire department for this week. The state sends a load up every day, and we dispense it to all the area businesses, police departments, fire departments. So we haven't, talking with, on the noontime conference calls, PPE is coming in, and there seems to be a flow of it. Initially, it was a rough go.
Yes, well, I appreciate the work that Dean Kamen has done with the state to try and get some of the PPE from his suppliers in China. That's been very helpful.
Amazing to watch this all come together. I think an after-action review of it all, this will really be a way to move forward in the future and get a hand.
Yes, I agree. We need to do that so we know what to do better next time.
Thank you.
Thank you.
Good, thanks, Chief. Next up, we have Jeremy LaPlante from Keene Fire.
Good morning, Senator.
Good morning.
I'm going to give a perspective from what I've seen with boots on the ground in Keene, but also I currently serve as chair of the state's EMS and Trauma Services Coordinating Board, so I'm able to hear from members all over the state as to what some of their concerns are. But the number one concern that's there has to do with reimbursement and our fee-for-service structure. Long before COVID was at the forefront, the current Medicare regulations only allow for reimbursement to a municipality or other EMS service if there is a transport to a hospital. This was a known problem, and the Centers for Medicare and Medicaid Services had a pilot program that they were looking to attempt this year called ET3, and that stands for Emergency Triage, Treat, and Transport. And that was going to change the reimbursement model. And the reason that that's important is because while all the fire chiefs here and as department heads look at their budgets moving forward, EMS services are unique in that they generate quite a bit of revenue for a municipality. In some cases, the most revenue that a municipality will receive. In Keene, it's around $1.2 million a year that ambulance revenue brings in. But again, that's only if a transport to a hospital occurs. What COVID has done is it's looked at who truly needs to go to a hospital. We look at surge capacities of hospitals and not only in how we're going to treat COVID patients, but does everybody truly need to go to the hospital? And when your hand is forced that the only way that reimbursement is going to occur is if a transport happens via ambulance, it's not the best utilization of resources. The Centers for Medicare and Medicaid have decided to delay their pilot program that was originally supposed to start on May 1st until the fall of 2020. And I think that that's doing a disservice to everybody that's on this call, because the sooner that we can change the reimbursement model for the delivery of EMS services, the quicker we can offer the flexibility to the boots on the ground to utilize both mobile and fixed resources in a sustainable way that's going to not only help us in the current crisis, but if there's any future resurgence. For example, if it doesn't matter if an ambulance or a fire truck arrives at a 911 call with a paramedic on it, if they are able to appropriately triage the patient to determine the level of acuity, and then potentially either treat them in the field or transport them to not just a hospital, but perhaps the most appropriate thing for them is a walk-in clinic, or maybe it's a matter of working with their primary care provider to have them treated and left right in their home. With revenue looked at so sharply and that having a direct impact on the jobs and the sustainability and the job security of our first responders, the quicker that we can change that reimbursement model to the way that it should have been for years, the sooner that all of the department heads and everyone on this call can use that to advocate for their membership to protect those jobs going into both this budget season and future budget seasons.
Okay, so let me make sure I understand what you're saying. If you respond to that 911 call with a paramedic on a fire truck and you are able to treat them where they are and you don't have to transport them to the hospital, you can't get paid for those services that the
Correct.
paramedic has performed?
Correct. The only time that reimbursement occurs is when an ambulance transports that person to an emergency room. Sorry.
No, well, supposing you had to support somebody or to send somebody to a long-term care facility, for example, that was where they needed to go. You can't get reimbursed for that either?
There are different programs for things like community paramedicine that looks at some things like that and interfacility transfers. But if a what I call a lower acuity call, if someone calls because they're having difficulties with opioid addiction or alcohol dependence, and
Right.
really they need assistance and connection to other resources, there is no reimbursement methodology in place for that.
I would think that's something that we ought to raise as we're looking at this next legislative package, because as you point out, that would be a better use of resources. So thank you for sharing that. I'm sure somebody from our office is on so that Sarah can make sure we get all of the details so we can follow up on this.
I can see Ariel furiously taking notes. I think we're good. Great. Thank you, Jeremy. Next we have Guy Newberry, interim chief from Concord. I can hear you now, Chief, if you're, I think he's still on.
Hopefully you didn't get a call.
Yeah, I know a couple people had a little challenge dialing in. Okay, we'll go. I'll move on. Do we have Glenn Davis on the line? I will unmute you. Glenn, are you on the line?
I'm here. Good morning.
Oh, great. You're up next.
Hi, Glenn.
Good morning, Senator. So when I learned about this meeting, I took some time and I called a few of the local fire chiefs and I spoke to some of our members. As president of the New Hampshire State Firemen's Association, we have a large group, largest in the state actually, of call and volunteer firefighters. So one of the big things that kept coming around to, I mean, I've heard the whole PPE conversation, that was part of it as well. The decon equipment is another big thing that these smaller departments are having trouble getting their hands around. The supplemental grant time frame, several of them asked if that could have been a little bit longer because they didn't have the time to be able to get that done. I think I heard that earlier from the Hanover chief as well.
Yeah. Can I ask, when you say decon, is the issue the cost or is the issue you can't get a hold of what you need?
It's a little of both. I think it's not in the smaller departments. They don't have the budget for that. My local department here in Marlboro just bought one. I think it was what did you call it? A hydrostatic sprayer, and it was $1,200-$1,500, something like that. And
Wow.
they're pretty well to do. But you take a real rural community, they just don't have that type of stuff in their budget. So if that were available to them on a national program, it certainly would make it a lot better. But the other thing that I found interesting after talking to these people is one thing you need to understand about first responders is they go to a call, they treat the patient, they transport the patient, they put the fire out, and then they go home and the call is over. This thing is ongoing.
Right.
At the horizon, it keeps moving further and further away as it goes on, and it's not an emergency first responders makeup, if you will. They usually can see an end. You know, if a house is on fire, eventually it's going to go out, and they don't see that here. So they're very concerned about what's happening in the future, whether their stimulus is going to continue, whether they're going to be able to get the funding that they need, and, you know, hopefully at some point find that horizon.
Boy, well said. I think that's an uncertainty that we all feel anxious about. And since you all are there responding on the front lines, it's understandable that it's a bigger issue for you because you're dealing with it every day.
Right.
And I wish we had an answer to when this is going to be over.
Oh, and everybody does, and you know, the world does. I mean, that's for sure. But it's an emotional drain on the first responders, and from what I'm hearing, is because it's repetitive. It's not the usual go put the house out, go home type stuff. And the stimulus that the firefighters are receiving here in the state does make some difference financially to them. And obviously, we've got the means in place if they do get have exposure that they can get their time out, to the 14 days. But if they take it home, that type of stuff is really an emotional draw on the call and volunteers. So we're finding their responses are falling down. They're not coming out because they're concerned about what could happen. And I don't know if there's really any fix for that at this point. But if this does drag on, we certainly would like to see the stimulus that we're getting now from the state to continue to those folks.
Yeah, and actually I'm sorry, that's the buzzer for the votes here. In the legislation that passed the House, there is a HEROES fund. The whole act is called the HEROES Act, but there is a fund to continue exactly what New Hampshire has been doing to be able to reimburse frontline first responders, frontline workers who are dealing with this because you're the ones who are really at risk here. So hopefully we can get that done as the package comes over. And I look at this as a several part problem. So right now and for the next months, for the foreseeable future, we've got a challenge of trying to help people get through this period. And that's what we ought to be thinking about in the legislation. But longer term, we've also got a challenge in how do we help stand back up the economy? How do we help people with jobs long term, with making sure that businesses can start up again, making sure that you all, that there aren't so many first responders laid off, that cities can't and towns can't provide the services. So I do think we're looking at not just a short-term issue of trying to provide assistance, but longer term, we've got to be thinking about what we need to do to help in the next year to two with communities, with people who are still going to be in need and need help.
Good. Thanks, Senator. I know hearing that buzzer, you need to go vote. So we'll just take a pause while you run up to the floor and come back. So opportunity to freshen your coffee, grab a glass of water, whatever you need.
Great.
Senator, we'll be right back.
Hopefully I can get up and back very quickly.
Okay. Thanks for your patience, folks. I appreciate it. And I know some folks had trouble dialing in, but I can see you are all on here. So that's great. I appreciate it.
Sarah, can you hear me now?
Yes, I can hear you.
Okay. Sorry, I don't know what happened earlier. I can see it listening in, but.
Yeah, no worries. I'll have you. You'll be up next when she comes back.
All right. Thank you.
Yeah, and just time check, folks. We have about 20 minutes left. So if you could just keep it concise, I want to make sure we get through everyone who's left here on the list. So I'll do my best to do that. And apologies again for the vote, but can't be avoided. Senator's on her way back down, so should be just another minute.
1 minute.
Great. That was quick. Thanks. Next up, we have Chief Newberry from Concord.
Good morning.
Morning.
Couple quick things. I exactly agree with Jeremy. LaPlante was one of my items on the, especially as we migrate now to the telemedicine and stuff, and we encourage people not to go to the ER unless they need to. We've certainly seen a decline in our EMS transports, and it's a big part of our revenue stream. So that's one, but he spoke on it very well. So,
and we've seen, as you probably are aware, we've seen CMS loosen up on telehealth audio only because we've got so many rural communities that don't have access to the internet, and they've loosened up on reimbursement. So hopefully we can get them to look at this again.
Yeah, that'd be great. Thank you. Information has been key from right in the get-go on this, and we relied very heavily for guidance from the CDC website. That was kind of, fire service is always looking to a national standard, whether it be NFPA. So we determined that CDC was going to be our baseline from the get-go. But I think as you've seen information, we learn more and more about the virus. But if you look at the website again today, I just checked it for EMS guidance. It's still dated, last update was March 10th. So, I mean, I know there's a lot of information out there, and now we're getting it from other avenues that it's valid. So I think that's key, is to maintain and make sure that we're utilizing the CDC to the fullest, because that's our best source of information. Supply chain, we're very fortunate, as you said, to have the state and a big resource. That was a challenge for us initially, especially when we're dealing with things that are not NIOP and stuff that we're used to. We're trying to determine what KN is, what is good for. It takes a lot of our resources away when we're trying to determine that. Grants have been pretty well covered, particularly the AFG. We couldn't even apply for some grants just because the amount of staff time that takes. We know what work goes into the AFG grant, and to have this as part of AFG was just too cumbersome. We've already lost one of our staff members that was sharing with the state as a resource. So we're already down a deputy. So he's been a big help to them over there. But then when you add that on to the additional work of the virus and losing staff, you just can't keep up with the amount of variety of grants. That and have to weigh are we getting a match for this grant or not for that grant, and try to determine what's the best avenue for us to pursue. So grants are a challenge.
There were very short windows in the CARES package. Hopefully we can have a longer window in this next package. And as I said, hopefully we can continue to waive the match requirement.
Yeah, that'd be a huge help, because that's determined basically where we decide to allocate different funds. Testing is huge still. That's allowed us at times to get employees back to work much sooner when we've gotten a test back from somebody. And now that they're much more aggressive in getting a number of people tested in the state, the lag time continues to grow and grow. So that's key. Whatever we can do is support on testing, big help on getting employees back. So my big things, and I think at some point, maybe sooner than better, is to have some kind of a task force to look at, what can we do better? We're fortunate to have the state has stepped up and done a lot of great things in communicating. But I think overall, there's a lot of things we could have improved and moving forward. So those are my key issues. Thank you for taking the time.
Well, thank you. And thank you for pointing out the CDC issue. It's been an issue I know in a number of ways, and they're making sure that they provide the most up-to-date information and that they not be prevented from issuing specific guidelines, I think is helpful. I know that one of the concerns that I've heard is that some of the guidelines have been so broad that they were not very helpful.
Yeah,
So,
best said. I didn't want to get into too much detail, but you got it.
Yeah.
Thank you.
Yeah, thanks, Chief.
Thank
Next up, we have John Mcallister from Nashville Fire.
Good morning, Senator. Thank you for having me on.
Hey, John.
So pretty much the topics that I was going to bring up have already been covered by Billy, the rest of the fire chiefs. We don't do frontline EMS as far as first fire line ambulance. So we are first responders. But one of the big concerns here in Nashville is that this has changed our response to all medical calls. So we're utilizing PPE that we haven't had to utilize in the past. Right now, the city of Nashville is in good shape for PPE. But if this surge happens, like they're talking in August, fall, the winter, our concern is what happens then when we run out of the PPE that we are currently using and moving forward. And like I said, our response is now anytime we go to a medical call and we're assisting the ambulance in the city, we are utilizing this PPE. So that's one of our concerns here. The other concerns that I'm getting on a regular basis from our members is just the benefits that they may receive if one of them contracts this, and unfortunately doesn't allow them to come back to work, or they're out of work for an extended period of time. That's been a concern of all of our members since the beginning of this operation. But again, to reiterate, the chiefs, all of the chiefs, and Billy is the money situation and reimbursement to the cities and towns. I think right now we're in good shape, but we're going to see that change here in Nashville, as I'm sure everybody in the state is going to feel the burdens of this economic crisis anyways.
So can I ask, have you had people who have tested positive, who have had to be out and have not gotten paid
Nope.
while they were out?
Nope, we have a COVID leave policy that the mayor had established early on. So if one of our members does have to be quarantined for some reason, we've had probably over 20 members quarantined throughout this process. And that's because they've either come in contact with somebody on an emergency call, and they for whatever reason, they were not fully PPE'd, or they had contracted it outside of work from a family member. But the algorithm that we're following here in Nashville is the 48-hour look back. So it'll go back if I'm come down with the signs and symptoms, it'll go back 48 hours of the people that I've been in contact with. That will then take those members and put them in quarantine for 14 days until my test results come back negative. So we've had probably over 20 members, and yeah, the city has been great in regards to the COVID leave. They go out not using their time, and we've had nobody so far test positive, which is a positive thing, and all of our members have returned to work within a week. Anyways, they haven't been out. There's been a couple due to family members that have been out for the full 14 day quarantine. But I think the question that I'm getting is if this is an ongoing, if for an unfortunate reason they do contract this and they're unable to come back to work. So.
I was in Nashville, as you may know, in early March and got a presentation from the city about all of your preparations. And I was very impressed with the work that the city had done already before things got bad. Can I ask you, I know that you all have dealt with a couple of long-term care facilities in Nashville where they've had a particular outbreak. Was there anything there that you think is important for to alert officials about, or anything that you think we should be paying attention to that we could do better to respond?
No, fortunately, those long-term care facilities are not in my district, so I've not had to deal with them. But the members that do respond to those on a regular basis were concerned. One of the big concerns that came up was we would go to those long-term care facilities for lift assist on a regular basis. They have help there that for whatever reason couldn't assist with the lift. So they would ask the fire department to come down and help out. But in the process, you would have security, you would have nurses, and you would have them all still respond to the room to help. And one of the concerns was that with the outbreak and the amount of employees that were exposed to the COVID and testing positive, was that they were bringing this in to the room where there was no need to be, where we were going to assist an occupant to help them either back into their bed or whatever the case was. But that was one of the biggest concerns, was just trying to alleviate the staff from coming down and helping out. I don't have a real good answer for you there, Senator.
Well, I know there are a number of things that, a number of pieces of legislation that we're looking at to try and help with long-term care facilities, which have not got the same amount of help as hospitals, I think, and where we've had outbreaks in a number of facilities in New Hampshire that have been very tragic. It's important for us, I think, to think about how we can do more to support the work that's going on there.
Mm-hmm.
Let me also say on the source patient issue, because that's something that we heard about very early in our office, and I had a chance to, as the result of that, I called Dr. Redfield, the head of the CDC, and specifically asked him if they would issue guidance that would help to prioritize source patients in terms of testing and getting the response to those test results. And I know that we did get Washington to talk to our Department of Health and Human Services in New Hampshire to try and speed that up. So I think that's gotten better.
Mm-hmm.
Hopefully you all feel like it's gotten better too.
The turnaround time for testing our members has been pretty good. It's gotten better. Yes.
Great. Thank you.
Thank you.
Thanks, John. Next up, we have Nathan Borland from 45th Parallel EMS.
Good morning, Senator. Thank you very much for taking the time to meet with us like this. It's very much appreciated. We are a very unique agency in that we cover a very large portion of the state that's very rural. We are one of only a handful of private nonprofit EMS-only agencies in the state, which excludes us for the most part from AFG grants and that kind of stuff because we don't do fire at all. To give you an example of what I mean when I say a rural department, we cover 9% of the landmass of the state of New Hampshire and 0.3% of the population. We're very heavily dependent on tourists coming in, ATVs, snowmobiles, all of those, coming in to spend their money up here and play, which also then generates calls for us. So we've been very, very hard hit economically with just the lack of call volume now because everybody's gone home. Nobody wants to go to the hospital, so we're not doing the transports. As it was said earlier, the only way we receive funding is that fee for transport. We are literally covering an area the size of the state of Rhode Island with 4 ambulances total. 2 are staffed at any time. And I'm looking at, within the next couple of weeks here, having to start cutting one of those 2 trucks down for this large of a landmass, basically because of the loss of reimbursement for services. In April, we lost, I believe my number is around $64,000 in patient revenues, and it's looking like May is going to be more like $80,000. Both of those numbers reflect more than my monthly payroll. All of our providers, we have 14 full-time providers, 1 full-time administrator, and 6 part-time people that do 24-ish hours a week. They're all of our clinical people are based on a 24-hour shift, so we do 2 of those a week at 48 hours. We've already started cutting that back to 36s, which cuts 1 truck off overnight. And we're going to be looking at, do we drop to 1 truck completely, which basically halves everybody's hours. We originally did not apply for the whole payroll protection program because at that time we were doing well still. We're coming off of our best February ever. We had thousands of snowmobilers up here. We were busy, and now we're sitting around doing absolutely nothing because nothing's happening up here economically. So we're at the point where funding-wise, we're in serious trouble. We did get a $32,000 stimulus check from CMS based on last year's Medicare revenues at the beginning with the CARES Act. And thank you for that, by the way. That will be used up with our next payroll. And then we're looking at dipping into a line of credit for paying people after that.
And do you transport people who are on Medicaid as well?
Oh, yes. Yeah, we take Medicare, Medicaid, private insurance. Absolutely.
So have you gotten any revenue from that? Because they're supposed to be also providing revenue to people who provide services under Medicaid as well. Have you gotten any of that yet?
I don't know how the breakdown of the one stimulus payment we got, whether it was all Medicare or if it had some Medicaid in it as well, but we've received the one check for $32,000 basically.
We should follow up with you because it may be possible that there's some revenue there. The other thing I would say to you is there's still money left in the PPP program.
Okay.
And I think there are going to be some changes to that to make it work better for businesses as the result of this next legislative package that will extend. I'm hopeful. Obviously, you never know until it's over, but I'm hopeful that 8-week period is going to be more flexible. So either extended right now in the House bill, it's extended to 24 weeks that you can use it. There's a longer payback period if you don't wind up hiring back all of your employees, and there's some more flexibility. So I would urge you to think about that because that may still be an option that could be helpful.
Okay.
The other thing I would ask you when, in terms of the pilot program that CMS is talking about, would that help you all at all?
It would a little bit. We do have some cases where we go out and we don't transport, so we don't get paid for it. We're certainly a little bit less in that respect up here because people generally don't call us until they're really sick anyway.
Yeah.
But we do have a fair amount. I think we're averaging probably 20 or so a month of non-transport related calls. But I mean, that is an issue, but it's not our biggest issue by far.
So you don't get any revenue from the cities and towns, from Borland and the towns you serve, or do you get from the county, anything?
We do. We half of our revenue is tax based. The other half is they just make up the difference in what we don't get in patient revenue. The difference between the cost of readiness versus the cost of fee for service, basically. We, regardless of whether we go out or not, we have people standing by ready to go. And so if we don't go out and, actually do anything that generates revenue, there is a tax subsidy that does make up for some of our budget. But again, we're also serving the poorest area of the state as well. Right. And I am very worried about what next year's tax assessment is going to look like for our budget too.
Yeah, me too. No, the reason I ask is because I'm trying to figure out if we are able to get additional funding that can go for services at this local level, whether
Right.
that helps you or if you're in a totally different category.
We're in a totally different category because we're not a municipality. We are actually owned by the towns that we serve. So Colebrook, Pittsburgh, Clarksville, they all have a share in owning us, and that's why they pay us the tax appropriations that they do. But you couldn't just give, X amount of dollars to Colebrook for their ambulance service because we're not a municipality in that respect. So that does make it kind of challenging. Like I said, we're fairly unique up here.
Yes, no, I appreciate that. But let us follow up with you and see so we get the specifics so we can track that as we're thinking about the next legislative package and see how we can be helpful. Thank you.
I really appreciate that. Thank you very much.
Great. Thank you, Nathan. Next up is Chris Lemlin from McGregor.
Hi. Thank you for taking the time, Senator Shaheen.
Hey, Chris.
So, a little bit like Nathan, McGregor's a little bit unique in that we're a nonprofit service. We cover UNH as well as the communities of Durham, Lee, Madbury.
Yes, you cover me.
Well, you should come visit us sometime then. Maybe when it's safe to do a visit again. I'll tell you what has been really inspiring is, we primarily use volunteers. We have some paid paramedics. But to see our volunteers really step forward, even though it's been putting themselves at greater risk. So that's been really, really cool from my perspective. I just want to build on some of the things that Nathan and Jeremy have said in particular, and I think others as well. The billing, the fee for service part of this is so fundamental to how ambulance services are provided really nationwide. And like any of the town departments, essentially we're funded by the ambulance transports that we provide. And I think that's been spoken to pretty well. And then ultimately what's left over, what isn't funded by either private or public insurance or the bit that goes to the patients, ends up getting charged the taxpayers. One of the challenges that I don't think has been addressed here that I just want to touch on is that we are all left to negotiate with private insurance companies individually for the contracts. And the challenge this creates for us is that we're all so small that these insurance companies don't really have a great incentive to work with us on that. And what that inevitably results in is an underpayment, which burns the tax base and it weakens all of our resiliency when we're facing a disaster like COVID-19. So to the extent that it's possible, I would just say that federal programs should really encourage these private insurance companies to pay their fair share for ambulance services. And that's going to help, I think, everyone on this call and really everyone nationwide. The only other thing I just want to say is, and just to echo what Nathan said, is just a request for equity in funding. We had taken a hard look, and we did ultimately end up applying, taking a shot and applying for the AFG grant for PPE. Mm-hmm. But it is the case that of the $100 million allocated to that grant, they set aside a maximum of 2% that could go to a nonprofit EMS service like McGregor or 45th Parallel, even though, quite honestly, our PPE needs are exactly the same. And, what I need to protect my volunteers or staff is exactly the same as anyone else. So to the degree that those programs can, A, receive more funding is always wonderful, but B, be opened up to be equitable for all first responders, that'd be tremendous.
Well, there is more money in the House bill that's coming over, and I think there is also more flexibility in terms of coverage for things like PPE. So we will take a look at the other piece that you mentioned, the 2%, because I was not aware of that.
Thank you.
Good. Thank you, Chris. Last but not least, we have Chief Goonan. Been very patient. Thank you.
Am I on?
Yep, you're good.
Awesome. I can't see me, so there I am in my office here. Well, thank you very much, and there was some really great points, and I think Sarah put me on last because you guys have taken most of my talking points out, so I've thrown them out the window. But it'd be nice to get back to where we were before, and maybe just back to the good old-fashioned drug crisis, but I'm sure that's not going to be going away anytime soon either. But here in Manchester, and I think in other places, we wear two hats, and I'm the emergency management director here, and we hit the ground running like much of folks early on. So we were opened up with the EOC very early in this pandemic, and it's been, I very rarely get to my office anymore, still to this day, because there's just so much going on, and especially in a city, still not the largest city in the world, but certainly the biggest city in Manchester, and there's a lot of stuff going on here. And they depend on the emergency management organization and director and the health department really heavily. So it's, just thinking about what we've been doing over the years and what the whole fire service has been doing, over the last couple of months, and it feels like a year. But it's really not your father's fire department, you know what I mean? It's really... we've taken on so much of this crisis and this pandemic, and there's a lot of moving parts. It's been very fluid from the beginning. And I guess one of the issues right from the beginning was that communication part. There was very little communication from the state down. I think we were all trying to get our feet under us, and we were pretty surprised by how quickly this ramped up. There was certainly a lot of moving parts here. And I think there was some apprehension from the state down to the city, from the feds to the state on how quickly we ramp up and how, and who is going to be the decision maker, who's the experts.
Right.
Do we follow the CDC? We reach out to DHHS. Fortunately, we have an extremely strong health department. But what it really came down to in the early parts of the pandemic here for Manchester was, hey, look, you're in Manchester, take care of Manchester. And if there's anything you need from the state, try to reach out and we'll provide what we can. But we became, on a constant search for PPE. We're in a constant search for cleaning supplies. And when you're sitting in the EOC and all these organizations are looking for you to provide that for them, it was really a scramble. All bets were off as far as, we were asked to do a lot of things, including testing, setting up the alternative care site. Right now, we're testing, really at this point, probably hundreds of people a day. And that's from just the fire department alone and with our health department. It's really.
And do you have all the tests that you need?
Right now, yes. For a while there, we were opening up the testing sites and we were reaching out for equipment right to the end of the day before and even into the morning, as well as getting some directions from, there's a lot more moving parts to setting these places up. So for when we first started, we were trying to deal with the folks that didn't have a doc, that need to be tested, that might have been symptomatic. So we started a call-in center, kind of emergency call-in center, or the emergency operations center, staffed by some hospital nurses, and then it was taken over by our health department nurses. So there was, it was so fluid. There was so much going on, and early on there was a little back and forth from the state. In fact, for the most part, we had to do it was backdoor kind of end around, so I could find who I could speak to find a decision maker. We finally got a person in our EOC, essentially full time from the state, so we had that kind of conduit. I know you guys all know Perry Plummer. He's been a huge asset to us.
He has. He's done a great job.
He's been my absolute direct line. Then Paul Parisi stepped up, and basically we go back and forth to those two folks. But I don't think, it was kind of foreign to us when this whole thing started, because we're used to an organization that there's an EOC, that you speak to the state EOC, that goes back down. So all that organization was completely thrown out the door early on. So then other things started to happen that were very, before we knew it, we had a pretty big homelessness situation that we're dealing with now. And we knew it was coming, as we took a look at, the population, what we've been dealing with over the winter. We knew that if something happened in our homeless shelter, which houses about 150 people, we knew that if we lost that, we were going to have a significant issue. And of course, we had a couple positives that turned into another couple dozen quarantines. And then when you're dealing with a population that's severely mentally ill and riddled with substance use disorder, they're not going to be quarantined. So they went out into the encampments. Unfortunately, by that time, although we couldn't keep those facilities whole. In other words, the New Horizons facility. When we lost that, people just chose where they wanted to go. So based on CDC CDC guidance, we just left people where they are, reached out to the state. Now, by this time, everyone kind of caught their breath and they started moving forward, and those funds came in, which were fantastic. Once those CARES Act funding came in and all those different bags of money, we could really start making some decisions in the state was very supportive with what we were making as decisions in the city EOC. So we ended up right now, and also I can add, we right now we put together a COVID response unit from the fire department. So we have people partnered with Manchester Mental Health. So we're in the field 8 hours a day, 7 days a week.
Wow.
Trying to support those encampments based on CDC guidelines. So it's basically for infection control and to keep people where they're at until those guidelines can guide us to another direction. The state also stepped up and they've cleaned 3 facilities. We reached out to the Diocese of Manchester, and we have some other agencies that stepped up with buildings. So what we're doing now almost full time is trying to message to the encampments that this is not a permanent situation, and within the next couple of weeks we're going to be bringing you inside because we do have clean facilities. But you're dealing with a population that's not
right. I appreciate
very
that.
difficult. So I mean that's just part of it. I mean everyone made some really great points, and I think we're all dealing with the same things, as well as we're looking at some of the aldermen here in Manchester who are looking to direct us to do a 10% reduction in staff, which is absolutely ridiculous. That's back for me. That's back to 2009 levels. That would mean 50 people laid off, and in the middle of a pandemic where we're certainly not. We're not doing our traditional roles anymore, and we're a whole different organization. We're really an all-hazard, all-crisis organization now. There's no more, like I said, it's not your father's fire department. So, on one end, you're very proud that we can move our organizations forward and kind of change with the times, but we really got to get our representatives, especially here in Manchester, to realize how immense our job is now. And and early on, we were talking to some of the docs, CEOs from the hospitals, and one of the points that stuck with me, and through this, we've planned a lot, and we've had a lot of plans here in Manchester on these sheltering, and we've had we were dusting off a lot of these old plans from Ebola and everything like that from back in the old days. But this one was different. When you talk to the docs who are in the know, and they're like, Danny, this may not be the pandemic that's going to get us, but this is certainly going to test us, and really after this, this after action reports could be very important moving forward. So I think there's going to be a lot of things coming forward from that.
I think so too, and I think it's important, as you know so well. Hillsborough County has been hardest hit. Hillsborough and Rockingham counties have been the hardest hit. When I saw the statistic that 60% of the hospitalizations for COVID have been in Manchester and Nashville, and that brings home just the challenge that you've been facing. Mm-hmm. We provided, New Hampshire's gotten $61 million. I'm not sure if it's all come in yet for testing, but hopefully that will help as we think about what we need to do going forward. Because everything I've seen suggests that as we open back up, our need for testing is probably going to increase, not decrease, and testing and PPE for that matter. So making sure that we continue to support that is really important. And
I had a conversation today with Paul Haas from Dover, and they were asking about doing the testing in that Dover area. Right now, we're doing testing for all the buildings that are for disabilities or elderly housing, or we call them the high rises here. As I'm looking out my window, so we're hitting all of those. We have dozens of them in the fire departments.
That's
out there.
Great.
Every one of those are on our list. So we are certainly a different organization, I think, all through the state. So looking forward to being really the lead organization when it comes to responding to these types of things, I think is on all of our radars.
Good. Thanks, Chief. I'm sorry, I want to be sensitive to the time, Senator. I know you have to hop on another call. So if you want to wrap it up at all, go ahead.
Well, I just want to thank you all so much for being willing to share your time this morning and what you're experiencing and for what you're doing every day. We will do everything we can to support you. Thanks.
Thank you very much.
Thank you. Thanks all. Take care.
Thanks, Senator.
Thanks.